Addiction Medicine Essentials starts the conversation. The Addiction Medicine Conference takes it further. Join us virtually for Addiction Medicine Essentials on October 16th and 17th, 2026. Practical, foundational training designed for professionals across healthcare, behavioral health, and community support systems. Gain real-world tools, fresh perspectives, and strategies you can put to work immediately. Then, join us in Raleigh, North Carolina for the Addiction Medicine Conference, March 18th through the 20th, 2027. North Carolina's premier gathering for clinicians, leaders, and change-makers advancing addiction care across the region. 2 experiences, 1 mission: better care, stronger systems, and healthier communities. Start online, continue in Raleigh. Addiction Medicine Essentials and the Addiction Medicine Conference. Be a part of what's next. Learn more and register at addiction-medicine.org.
Substance use doesn't always look the same across communities, and in some cases, it's the conversations we're not having that matter most.
Welcome back to the Governor's Institute's Addiction Medicine podcast, where we explore the latest in substance use care, clinical practice, and community-informed approaches to improving outcomes. Today's episode kicks off a special 3-part series focused on Tarang, an initiative focused on connecting with Asian American and Pacific Islander, or AAPI, communities in more culturally responsive ways. I'm your host, Amy Johnson, with the Governor's Institute. As part of this series, we're starting with the foundation, understanding how substance use disorder shows up in AAPI communities and why these conversations can be difficult to have. And it comes at a good time. May is Mental Health Awareness Month and AAPI Heritage Month. While data may sometimes suggest lower rates of substance use, the reality is often more complex. Cultural stigma, underreporting, and barriers to care can mean that many individuals are struggling without support or visibility. To kick us off, I'm joined by Pooja Mehta, the creator of Tarang. Pooja, thank you so much for being here and driving this new series. I'd love to start with you, your background, and what led you to create Tarang in the first place.
Thank you so much, Amy. Thank you so much for having me and for covering this topic. So Tarang is a program through the Division of Mental Health, Developmental Disabilities, and Substance Use Services that partners with AAPI communities throughout the state to break the culture of silence around mental health, substance use, and suicide. This work is really rooted in my own personal experience. So I was diagnosed with anxiety with auditory hallucinations when I was 15. And I had access to all of the resources that someone could need. My parents were very supportive in getting me help. I was able to get connected to a psychiatrist and a therapist fairly early on in my symptoms. But one of the things that my parents told me was to not tell anybody about what was going on because we were part of a pretty tight-knit South Asian community here in the Triangle. And basically what that did for me was kind of reinforce this idea that I cannot have a mental health condition, I cannot have a mental illness, and also hold on to my identity as an Indian American. And what I was much more comfortable with my identity as an Indian American. That was where I got my social connection, my cultural connection, my religious connection. And I didn't particularly want to have a mental illness. So I just didn't engage in care. I just had this idea in my head that I'm fine. I don't need help. And, as you know, if you are not an active participant in your care, it doesn't work. So even though I had access to care for 4 years, I was not engaging or benefiting from that care. And once I started telling my story, once I started doing advocacy work and really engaging in my care, I saw a fundamental difference in myself. But I also saw so many other people reaching out to me saying that, they were really glad to see someone who was Asian American talking about these issues, that they had had similar experiences, but please don't tell anyone, right? So it was creating this dynamic of, a lot of trees in the forest who can't really see each other. And there's a lot of need in the community, but there's this sense from every person in the community that they're the only one who's navigating this and that they can't connect with each other on this topic. There isn't that safety there. And what that's translating to is that Asian Americans as a whole are getting left behind in the conversation about the future of mental health because we do not feel safe contributing our voices and voicing the needs of ourselves and our communities in these conversations.
When we talk about Tarang, what does that initiative represent, and why is it needed? You're touching on it, but tell us a little more.
Absolutely. There is a lot of phenomenal work that is happening across the country to address the mental health and substance use needs of Asian American communities. But that work really focuses on supporting the small subset of the community that already buys into the belief that mental health is important, that substance use disorder exists and is something that should be treated. The majority of our population does not hold that belief, or if they do not feel comfortable externally engaging with that belief. And so that is what I am trying to do. I am trying to break that culture of silence, and I'm doing so by working hand in hand with existing Asian American communities, temples, religious groups, cultural groups, to have a presence at community events and introduce concepts around mental health in a way that ties into the overall environment and feel accessible to the people there, as well as, creating standalone spaces where people can engage in cultural practices and engage in, traditional values, but tying that explicitly to conversations about mental health and substance use in a way that makes it feel safe to engage and accessible for the people that I'm serving.
From your perspective, how does substance use disorder show up in AAPI communities?
So before I dive into that question, I think it's really important to unpack that term AAPI. Mm-hmm. So AAPI stands for Asian American and Pacific Islander, and it is a term that represents people who have roots in 75 countries. That encompasses over 50 ethnic groups, over 100 languages. So, nothing I say can be considered a one-size-fits-all. It's just not possible. Mm. With that being said, in general, the biggest substance use disorder concern in the AAPI community is drinking. Social drinking, especially among men, is a big part of a lot of Asian and Pacific Islander cultures. And, that combined with the relative accessibility of alcohol in the United States compared to a lot of Asian countries because of financial access and, just walking into a grocery store and being able to buy it, combined with the stressors of immigration and assimilation, that culture of social drinking can quickly spiral out of control into problem drinking. And, we're also seeing a rise in abuse of prescription opioids and benzodiazepines, especially among those first-generation folks who might not have grown up with the access to education or support systems that can prevent this kind of abuse of prescription medications.
Pooja, we sometimes hear that rates are lower, but what's important to understand behind that data?
Yeah, so, data around Asian American mental health, substance use, suicide is very frequently underreported due to stigma, cultural shame, and a lack of safety. A lot of people cannot identify within themselves or loved ones, or do not feel comfortable identifying that they might be struggling, right? And if you're not feeling comfortable identifying with your friends, with your loved ones, with your community, you're probably not going to feel comfortable identifying on a survey or to your doctor or to someone who would be collecting these types of metrics. There's also a distrust of the healthcare system, right? Asian Americans and Pacific Islanders, we are not immune to the historical, ways that the medical system has co-opted people of color and kind of, made us abandon our cultural practices and our, the things that we are familiar with and sensitized to. And so even going into a lot of these spaces where, again, that data is collected, there are a large portion of our community that just simply do not engage with the traditional healthcare system. There's also the premise of data aggregation, right? Like I said at the top, the term AAPI is one category that is used to represent a huge swath of people, right? And so when you break out the data by ethnic group, by language, by immigration status, what have you, you see a wide variety in the way that substance use shows up in various populations. But again, that data can't really be considered accurate because we don't have good systems to track that, right? More often than not, if you are collecting data on Asian American and Pacific Islanders, that's as deep as you're going. So kind of getting that subset of like, Korean versus Indian versus Japanese versus Thai, like we don't even have access to that kind of identifying information.
So you mentioned stigma. That is a key part of this conversation. Can you go a little further into how stigma shows up in AAPI communities when it comes to substance use?
Absolutely. So for me, on an individual level, right, in order to kind of understand how stigma and substance use play into the Asian American community, we need to talk about the model minority myth. In the United States, Asian Americans, Pacific Islanders, we are labeled as the model minority, ascribing us to achieving higher socioeconomic success, especially like academic success, especially compared to other racial groups, which, in theory sounds great. But in reality, what that does, it colors how people look at us, and they see a version of us that aligns with whatever belief they are told rather than the reality. And how that translates into substance use is, from a care perspective, people might not be keeping an eye out for some of the warning signs of a problematic use of substance use disorder, right? Because if we're getting the marks and getting the jobs and getting the promotions and getting all the things that are like those quote unquote conventional measures of success, we're not going to look too deeply into seeing what's happening behind the scenes on that.
Right.
On the flip side, individuals can feel really, really conflicted on whether or not to admit that they're struggling, right? Because the same way that other people see Asian Americans, we have also grown up in a culture where we have constantly been told that we are the model minority and this and that does not equate to having a mental illness, having a substance use disorder, struggling with substance use. And so even just kind of admitting to ourselves that there might be a problem can feel like an uphill battle, and again, kind of contrary to the identity that we hold for ourselves.
What role do family expectations or intergenerational dynamics play?
Building on that, the stigma of individuals, right? Asian Americans, a lot of us grow up in collectivist cultures. Community is such a foundational and fundamental part of the way that our families grew up, our cultures are shaped. And when we moved here to the United States and started our life here, that hasn't gone away. But that means that when an individual is struggling, that can be seen as a reflection on the family, right? It can make it difficult for people to acknowledge that they're struggling because they don't want to bring their family shame. They don't want their family to be, judged or ridiculed for kind of what they did and their failures that led to this person struggling with substance use. And, even seeking help, like that could be seen as a judgment on the family. And the family might actually be the one preventing the person from getting help because we don't want people thinking of us differently. I think it's also important to think about, the intergenerational dynamics. A lot of folks, especially folks who are from Southeast Asian descent in this country, are refugees, right? And 2/3 of AAPIs in this country are immigrants. Navigating the trauma of war, displacement, the stress of navigating between your home culture and American culture, all while growing up in a culture where things like mental health, substance use, and trauma might not even have words in the language that you're speaking, that's a lot to kind of reconcile, right? And again, kind of with the accessibility of substances here, it can make sense why if that is something that you are engaging with, how that can quickly kind of be used as a Band-Aid, as a coping mechanism, and quickly lead to problematic use.
Right. Okay, so we're talking about things that prevent people from accessing care. What are some other common barriers to seeking help?
Yeah, so we talked a little bit about the family shame, but, when I was talking about Tarang, I talked a lot about safety, right? And our communities are very tight-knit. For a lot of Asian Americans, their communities are how they have social connection, how they have community connection. If they are struggling and need support, they go to the community, and the community does provide. But there is a sense that the community will not be receptive or will not be able to address or would not be able to really support someone if there is a challenge related to mental health, substance use, or suicidal ideation. And so a lot of people distance themselves from their community when they are navigating issues like this, which can make it difficult. Dr. Shukla has said, like, the opposite of addiction is connection, right? And when you lose that connection, again, that can drive you further into this pathway of struggling. There's also, the language access and cultural barriers, right? A lot of the resources that are available for people who are struggling with substance use disorder are only available in English, maybe Spanish, right? But they are certainly not available in the 50 languages that, people, Asian Americans in this country speak. And then the cultural differences, right? I mean, I have never sought treatment for substance use disorder myself, but I do remember when I was seeking mental health care, I once explained to a therapist in like an onboarding session what my family dynamic was like, my household dynamic. And the therapist, made a note and I saw in my like visit summary that, I grew up in an abusive household. And I was like, where did you get that from? And I asked her that, and she was like, oh, well, you were saying that your parents don't let you close your door, like, to my room. And I'm like, I don't know a single person whose parents do let them close their door to their room. Like, that is just not a thing in our culture, Yeah. And so I didn't see that therapist again. And luckily I'd had enough experience that I was willing to try again and find someone else. But like, if you're trying to dip your toe into something that is so uncomfortable and you have that kind of experience, you're never going back. Right. So, the kind of lack of cultural literacy around Asian American practices and some of these collectivist cultures and some of these multi-generational households, interfamily dynamics can really lend themselves to hostile environments if someone is trying to seek care.
Do you see differences between first generation and second generation experiences?
Yes and no. I will say that the on the surface, the barriers are somewhat the same. I will say the language access issue is probably not as strong with the second generation just because, in the education system, we do learn English. But they do present differently. For example, I would say the issue of cultural barriers, right? For a lot of first-generation immigrants who are trying to seek help, right? Like, they are trying to seek help where they're trying to find somebody who can understand what it is like to be an immigrant in this country and what it is like to have your support system be 8,000 miles away and what it is like to, basically be starting over and trying to build from the ground up and trying to provide support for your family in an environment that you yourself are not familiar with, right? For second-generation immigrants, it's the experience of the hyphenated American, what I like to call it. How do you hold on to your cultural identity and kind of, stay authentic to the cultures and the values that raised you while also acknowledging that you are part of a bigger ecosystem and you want to be able to integrate into that without fully letting go of some of the things who make you who you are? And what does that balance look like? And are you Asian enough? Are you American enough? Like the challenges that come with that, like belonging and what that actually means, And I'm a second generation immigrant, right? So I'm not going to say that first generation immigrants don't also experience that. But I think it is just kind of like on a different level. Again, just to give you an example, the other day I was at a grocery store and the cashier was also Indian. And she asked me, like, are you Indian? And I said, Indian American. And she's like, what do you mean? And I'm like, my parents are from India, but, I'm Indian American. And she gave me this look. And she's like, so you're Indian? And I'm like, no. Like, there's a difference, right, for me. And, in the struggle of defining yourself, there's also the challenge of trying to be able to hold your own when other people are defining you, whether it be people from your own culture or the general populace.
And this kind of speaks to the importance of culturally responsive approaches. Tell us about Tarang and the initiatives that are culturally grounded.
Yeah, so, like I said, a lot of Asian American Pacific Islander cultures are collectivist. Culture and community are so fundamental to so many aspects of our lives. And it is so important that when we think about this kind of, when we think about like moving the needle on how do we have conversations around mental health, substance use, and suicide in these communities, that we follow that model, right? And we really like embed the culture in it, right? I think one of the phrases that I really like to use is everybody has a right to privacy, right? You do not have to share anything with anyone that you don't want to, but there shouldn't be a sentiment of secrecy. If you want to share with your community, you should be able to trust that the people that you are sharing this with can meet you with kindness and care and compassion and are willing to hold your hand in helping you figure out what you need to do, even if they don't know the answer themselves.
And so what does it look like to build trust within AAPI communities around these issues?
I think it's important, first and foremost, to be present. Right? Be present and listen to the community, right? And I think, one of the, mistakes that I see a lot of initiatives take when they're trying to do outreach to the Asian American community and maybe to other communities as well, I don't know, is that they're going in with a solution. The first time they are engaging with the community is like they might have had a consultant or two help develop a program or something like that, but the first time they are having a presence in the community is with the solution to a problem. And the community is like, well, that's awesome. I don't know who you are, right? Like, why am I going to participate in this? And trusted messengers are a big part of that. Through Tarang, we partner with community organizations and we have community leads who are those trusted members of the community and who are bringing in other people from the community to help us inform what we do and how we do it and when and where we do it, because that's also important. And I think the second part is, be willing to learn and be willing to explore, right? A lot of pre and peri-clinical mental health interventions are rooted in Asian culture, but there has been such an effective removal of that connection that, I can't tell you the number of times that I have, yoga is rooted in Ayurvedic tradition, Indian tradition. I can't tell you the number of times that I have had a white yoga instructor tell me that I am pronouncing one of the positions wrong because I'm actually pronouncing it authentically. And I'm just like, ma'am, what are we doing? Right. So kind of that, like, when you are in a community space, you are not the expert in the community, right? You might be the expert in addiction medicine. You might be the expert in evidence-based practices, but you are not the expert in the community. And your job is to figure out, how do we take this expertise, right? That's not to dismiss the value that you provide, but how do you take the expertise that you have and merge it with the expertise that the community is providing to you in terms of how they operate, how they receive information, how they engage with each other, and the change that they want to see happen.
Mm-hmm. Pooja, thanks so much for joining us today and getting us started on this series. I think our conversation highlights how much can go unseen when substance use is shaped by stigma, cultural expectations, and limited access to care.
Yeah, absolutely. Thank you so much for having me and for the discussion.
In the next episode of this Tarang series, Pooja will join us again with a couple of physicians to take a closer look at what happens when someone does seek care. They'll explore cultural and systemic barriers through a clinical lens. To learn more about Tarang and other Governors Institute programs, visit governorsinstitute.org. Thanks for listening and have a great day, everyone.